It was quite difficult for a while, feeling as if I was having to turn back to a certain sense of rigidity in order to feel a sense of control in a world that was kind of going haywire.
The pandemic has taken a significant toll on many, but specifically on young women with eating disorders, according to recent data from the Canadian Institute for Health Information. Hospitalizations and visits to emergency rooms due to eating disorders surged by 60% since March 2020 among girls aged 10 to 17.
And I know what it feels like to be in the grips of an eating disorder, and I know how awful and isolating and terrifying it can feel. And the fact that there's just been this huge wave of people who are experiencing the same thing and who haven't been able to get treatment or care, or at least not in a timely manner, is quite scary and quite alarming.
For Canadian Ffion Hughes, a student at Oxford University in the UK, the pandemic set back the progress she made in overcoming anorexia nervosa.
I was fortunate in that I didn't have a full-blown relapse during the pandemic, but I did find myself moving back towards a lot of the rigidity that I'd finally managed to get rid of before the pandemic struck. So I was all of a sudden giving into old food rules, and I was exercising more than I should have been. I wasn't listening to my body when it came to eating when I was hungry. And in a lot of ways, it was kind of a slippery slope.
It's something that we are seeing a lot in clinic, but if we think about kind of risk factors, situational risk factors for the development of eating disorders, the pandemic led to a lot of isolation, a lack of control. So, people trying to find ways that they could manage anxiety, manage uncertainty, and food is often one of them.
While the pandemic may have been a perfect storm for those living with eating disorders, some say accessing healthcare has always been an issue.
We've had a serious gap in terms of mental health services for years. I mean, there has never really been an eating disorder system that is capable of taking in all the people who are in need of care.
We're, for example, a private clinic, and some people need support for years and years, but our services week to week are not accessible to everyone in the community. And, the Children's Hospital, for example, in Montreal, I know that their waiting list during the pandemic was over 6 months.
On top of more government funding for access to services, some say more prevention is key.
I think in our communities, in schools, with parents, with sports teams, that we can talk a bit more about assessment, intervention before it gets to a point where somebody is actually in need of hospitalization.
In Montreal, Alyssia Rubertucci, City News.